So this particular video is for people who had received a soft tissue graft. We take a graft from the roof of the mouth and we put it wherever we need to put it. And there are very specific recommendations to follow. That's why we thought we would make this specific video for people who received soft tissue graft. The very first thing that we noticed that is an absolute no-no is to stretch the tissue like this to look at your graft. Do not stretch, do not put pressure, do not put your tongue like that. Do not do any of that. Just let it be, let it alone, leave it alone, and clean your mouth as we showed on the previous video, and leave that area alone. The only thing you would do during the healing phase is, again, using the Q-tip in the mouth rinse and essentially going in the area that received the graft. Let's say we did grafting here. You're gonna go at the tooth level and you're gonna clean like this, and then change this, put another a little bit more, and go back like this. That's it. This is what received the graft. All of the rest you brush normally. You brush everywhere else normally very, very well, just like on the previous video. You don't want to come back for a follow-up procedure with your mouth full of food and that has sit there for many days and created inflammation, created cavities. So you want to avoid that. And essentially, that's why we wanted to really speak about this in particular, because we notice that people get upset sometimes and they start lifting like this, and that does not allow the tissue to heal. In fact, it leads to failure. So avoid doing it completely. For the rest of the recommendations, watch the previous video that speaks about all of the recommendations that we have. Now, one last thing I want to bring to your attention is the pain level. Immediately after surgery for a few days, you might have just regular pain, not too much pain. At day 4 or 5, you're gonna start having a pizza burn type pain on the roof of the mouth that will last for around a week or so. This is pain that's very, very annoying. Patients don't like it, and sometimes they get worried because they didn't have pain for a few days and now all of a sudden they have this new pain coming in that's very bad. So that's one point. The other point also is bleeding. The roof of the mouth will bleed, and sometimes it bleeds heavily and it feels like an emergency because your mouth is full of blood now. You cannot even sleep very well because it's drooping like that and you cannot stop. It is normal. When we strip the tissue, the roof of the mouth, from some tissue, all of that area will be bloody. It will bleed for at least a day. After that, usually patients report that they have a sudden stop in bleeding. They wake up the next day, there's nothing. Or they wake up the following day and there is absolutely nothing. That's what patients have reported. So do not be alarmed if there is a lot of bleeding, or if once it stops, it's because the area has stopped bleeding and now you could resume your healing phase.